from the Environmental Management Authority of Trinidad and Tobago. And today, Trinidad and Tobago will join the rest of the world in commemorating the United Nations' first International Day of Clean Air for Blue Skies. As a member of the Breathe Life campaign, the country has made a commitment to promoting and implementing actions to achieve clean air for blue skies. And as part of the commemoration, we have planned a few activities for today, which includes this webinar being a joint effort with the Pan American Health Organization. In today's webinar, we have invited experts from across the region to present and discuss on the theme today of air pollution, NCDs, and COVID-19, challenges and opportunities for a healthy recovery. We will have presentations from PAHO as well as the Environmental Management Authority, followed by a panel discussion with 5 experts in various roles of environmental management, air quality, and health. So without further ado, we will begin today's proceedings with some opening remarks from a few key personnel. So firstly, I would like to introduce Dr. Erica Wheeler of PAHO to make some opening remarks.
Good morning. Dr. Leo Heilemann, UNEP, Director of Latin America and the Caribbean Office. Mr. Hayden Romano, Managing Director, Environmental Management Authority, representatives of the Ministry of Planning and Development and the Environmental Management Authority, Trinidad and Tobago, and a special welcome to Ms. Giselle Joseph, our moderator. Colleagues from WHO, UNEP, and CARFA, as well as our own PAHO colleagues from the regional, sub-regional, and country offices, and participants from across the region. I see we have online now 59 persons. Good morning to everyone. It's really a pleasure for WHO and PAHO to collaborate with the Environmental Management Authority of Trinidad and Tobago in the hosting of this webinar in recognition of the first International Day of Clean Air for Blue Skies. The main purpose of this day, as you would know, is to raise awareness and mobilize global action to address air pollution. Can everyone hear me? I'm hearing a bit of interference. Okay. So I welcome you not just on behalf of the PAHO Trinidad and Tobago office, which, as you may know, covers all of the Dutch territories, Aruba, Curacao, St. Martin, Bonaire, St. Eustatius, and Saba, but also on behalf of Dr. Etienne, our director in Washington, and Dr. Tedros Ghebreyesus, our Director General in Geneva. You may be wondering why air quality matters, especially as it relates to health. Air pollution is one of the biggest environmental threats to health today, being responsible for an estimated 7 million premature deaths each year globally. In the Americas, at least 250 million people live in cities that fail to meet the WHO air quality guidelines for particulate matter. Furthermore, in 2018, at the third United Nations high-level meeting on NCDs, air pollution was recognized as the 5th risk factor for NCDs. At the same time, there is an estimated 200 million people in the Americas living with NCDs, and 3 out of 4 people in the Caribbean died of NCDs, with close to 40% of those deaths being premature, meaning between the ages of 30 and 70 years, which of course is all exacerbated by poor air quality. The data clearly shows why it is important for health and the environment to work together to tackle air pollution. Furthermore, the current COVID-19 pandemic highlights the need for countries to implement air quality programs, given that air pollution is a risk factor, as just mentioned, for people living with NCDs and other comorbidities, and they are at a higher risk for more severe illness from COVID-19. The extended lockdowns has given some glimpses of possible brighter future. In some places, emission reductions have tackled air pollution to such an extent that people have actually breathed clean air or seen blue skies for the first time in their lives. So this shows that it is possible to make a difference. On the other hand, the pandemic has exacerbated the health disparities and the burden of the most vulnerable populations. For those with no access to clean energy, more time at home means an increased exposure to air pollutants. In some parts of the world, this comes from burning crop waste, charcoal, wood, and kerosene for cooking and heating. The pandemic is bringing an unprecedented opportunity to prioritize health in our society. WHO Manifesto for Healthy Recovery from COVID-19 highlights the importance of protecting the air and granting access to clean energy as priorities to build back better. Addressing air pollution and other environmental and social determinants of health, which we know addresses the areas of where we are born, grow, work, live, and age, requires joint efforts. This includes the development of inter-programmatic efforts within the health sector, connecting environmental health with core public health and primary health functions, as well as intersectoral work with energy, transport, and industry. So therefore, Trinidad and Tobago are planning, Ministry of Planning and Development and the Environmental Management Authority and others are really to be congratulated for their leadership on air quality and health. As part of our technical cooperation from PAHO, we will continue to work closely with the environmental health authorities to strengthen the response to air pollution. So today, as we celebrate, we reiterate our commitment to work together with the country and to make a call to raise the aspirations of countries in our region to foster that regional action as small island developing states towards a healthier environment with cleaner air that protects the health of our people. So on this note, I would like to wish you all a very constructive discussion and deliberation, and of course to continue the good work. And we pledge our collaboration as we go forward. Thank you.
Thank you very much, Dr. Wheeler, for those kind words. Next, I would like to invite Dr. Leo Heilman, the Director of UNEP's Latin America and the Caribbean Office, to also provide some opening remarks. Dr. Heilman.
Thank you very much. Can you hear me well?
Yes, we can hear you.
Okay, first of all, Dr. Wheeler, PAHO representative, Mr. Hayden Romano, Managing Director of the Environmental Management Authority, representatives of the government, Ministry of Planning and Development, country representatives, PAHO representatives, ladies and gentlemen. First of all, I'd like to say that Dr. Wheeler's remarks are really on spot. We completely agree with it and completely support it. The information that she has provided is really astounding and of a big concern at the global level. That is why the General Assembly has established this resolution, or the resolution establishing the International Day of Clean Air for Blue Skies. I'd like to draw now attention to what is happening, I think, in the region. Recently, there was a publication that showed the 10 most polluted cities in the world from air pollution. And while our region, the broader Latin American Caribbean region, had a prominent space in this list in the past, we are not among the top 10, which means that there are policies that are being implemented on reducing air pollution that are working. But also, I would like to indicate that, as mentioned by Dr. Wheeler, there are, I think, the cities that are over 100,000 people in the region, all are not meeting, or most of them are not meeting the standards that have been established by the World Health Organization. So there's a lot of reason for concern. and also the fact that over 100,000 people in the Latin American and Caribbean region, not the Americas, the Latin American and Caribbean region, die prematurely each year because of issues related to air pollution. And when we look at the countries, we see some good examples and some not good examples. If I may look now at some key issues that are being done by countries in the region. Costa Rica, for example, has moved to 100% renewable energy by a combination, a mix of solar, wind, mini hydros, and geothermal energy. Paraguay is 100% renewable energy. Uruguay is almost 100%, 95%. Barbados has made a challenge to itself of achieving 100% renewable energy and carbon neutrality by 2015. Costa Rica also hopes to achieve 100% of their buses and taxis being zero emissions by 2050. And they've also established a policy towards decarbonization. And I think those are critical things that we need to learn from. The case of Trinidad and Tobago, where it shows through its policies of moving in this direction by one, the ratification of the Paris Agreement and the accompanying national determined contributions, shows a positive move in this direction. Also in TNT and joining countries in the region in endorsing the Caribbean Action Plan on Health and Climate Change, also sees a political will in this direction. And the issue of incorporating efforts in terms of mitigation and adaptation to climate change. So we see that there are positive trends in terms of looking at these issues. And also the fact that Trinidad and Tobago has recently joined the Breathe Life campaign, which is a campaign that has been really launched by the World Health Organization and the United Nations Environment Programme, and precisely at looking at the issues of air pollution and reducing the pollution in our cities. Now let's look at some of the key issues that are affecting the region in terms of air pollution and some of the key pollutants that are really of a big concern. And if I may focus in, I'd like to focus in on carbon black, and particularly carbon black that is less than 2.5 microns. Why? Because these particles resulting from the burning of organic waste, etc., can enter into your lungs, but are so tiny that they enter into the blood circulating system. And therefore, they contribute to diseases such as cancer, etc. So that is one of the main concerns. And what are the principal sources that we have in the region, which I think is where we need to zero in on addressing these issues. The first one I'd like to mention is from mobility. And it means coming from trucks, buses, cars, etc. And so that is one of the principal sources in the urban environment. And we need to address that. And the options we need to address that include electric mobility, be it trams, trains, subways, be it buses, trucks, cars. And an advantage that the Caribbean region has is that the distances, I mean, you can, on a full charge of battery in your car on a bus, you can drive around the entire island. And in other islands, you could drive around a few times. And so our geographic situation lends us to this solution in terms of eliminating air pollution from mobile or movement or the movement of people. The second area, which I think is really critical, is on open dump sites. In the Latin American region and Caribbean region, there are over 10,000 of these open dump sites. And in many of these dump sites, there's open air burning. And open air burning produces a lot of noxious gases, among which, not a gas, but particulates, is carbon black. And so the open burning on dump sites is another major source of this pollutant into our atmosphere, and another major source of the large numbers of premature deaths that was mentioned by Dr. Wheeler. And so the ministers of environment for the Latin American and the Caribbean region, through their forum, took a decision to form a coalition for the gradual elimination of these dump sites. And there have been successes so far. And the reason for that really is to eliminate this health risk that our population is facing, and particularly those that live close to or work within the dump sites. And I must mention the Solid Waste Management Company of Trinidad and Tobago has done a wonderful job in terms of making the Beetham site a sanitary landfill. And we need to move in that direction by instituting measures of recovery and recycling, which can reduce up to 70% of waste, and eliminating the burning of waste. So that is a key SU area that we need to focus in. Another important area is the area of cooking with charcoal and with firewood. And the reason why it's so critical is because the main people who are affected are those who are in the home most of the time. It's for cooking and for heating. The women and children, the most vulnerable in terms of being affected by carbon black. And therefore, policies that look at having more efficient conversion of these fuels to heat, more efficient burning of wood or carbon, or completely eliminating it and moving towards cleaner sources of energy such as gas and electricity. That's a third area that I think is important. I'd like to introduce another area which I think is important, is the burning of agricultural waste and forest fires. I put them together because these are incidents that are not continuous as we have in the mobility and in the dump sites, but is sporadic based on the weather and the season of the year. And I think that's another area of policies that can be used to address these major problems. So I would like to sort of sum up in terms of what I would think are key messages that are important in terms of addressing this issue in the Latin American Caribbean region. The first one is that we need to do more, and that is clear because even in terms of the Paris agreements, the studies have shown by the Intergovernmental Panel on Climate Change that what we have in our national determined contributions is not enough. In other words, what we are targeting is not enough in order to resolve the problem. So we need to do more. Secondly, as mentioned by Dr. Wheeler, the issue of regional and intersectoral cooperation is key. It's key to addressing these problems. And I have to mention as a Caribbean national, CARICOM needs to be strengthened in this area because the amount of resources they have to support the Caribbean region in terms of issues related to sustainable development, pollution, environment, it's not enough, it's not sufficient. And our countries need more support and more technical support in this area. So I'm actually calling for more support for CARICOM, particularly in this area. We need to reactivate actions in terms of the prevention and control of air pollution. And there are so many policies that are available out there and so many efforts, but we need to have political will and effort in this. So if I were to give some 4 or 5 simple messages, one, I would say that the region needs to move much more and more aggressively towards renewable energy for electricity, for example, through wind, through solar, through hydro or mini hydros, etc. I think it is important that we move in this direction because for me, as a Trinidadian or Trinbagonian, it doesn't make sense just burning gas to produce electricity, because gas can be used much more productively for the country in terms of producing materials that can be used, petrochemicals, etc. So I think it's a much more judicious use of our resources. And therefore, I would say that the countries in our region have abundant wind and solar energy available. And we just need to make the investment in doing it and reap the rewards of very inexpensive energy. If we look at the issue of mobility, I think the region needs to move to electric mobility. I hesitate to say biofuels because it depends on the ability to produce those products in the region. I don't think we have done much in that area. And so I see that electric mobility is a measure for public and private transport that can reduce the air pollution problem in our region to a significant way. The third area I would say is eliminating the solid waste dumps and the open burning of solid waste, which has been a practice in many of our countries. I mentioned previously there are over 10,000 open air dump sites in the Latin American and Caribbean region. And if you look at some of our islands and you go to them, sometimes you see dump sites that are burning for months and months. And that is producing carbon black and other noxic, furans, etc., that are carcinogenic and cause health problems. So I think we need to focus on that area. Also, the issue of reduction and elimination of forest fires and agricultural burning. It's much better to compost your material than to burn it off. And so I think policies in those areas would support everyone in moving in that direction. I think, as mentioned by Dr. Wheeler, not only PAHO, but the entire UN system is available to support Trinidad and Tobago and the countries of the Caribbean region in terms of moving in this direction. And I think this discussion today, it's quite important in terms of at least raising the awareness so that we can look at options other than the prior options that we had before. Trinidad and Tobago has always been an oil and gas economy, and there's need to look much wider than that. And if you look for investments in the region, you would see there's more investment going to renewable energy than other sources. And there's a good reason for that. It's because it's cheaper, it's more competitive, it's less polluting, there are less health implications. And so I would just like to mention a couple of things that we're doing in the region, which I think is important to mention. I already mentioned the voluntary coalition of governments that working towards a progressive closure of dump sites in the region. And I think our governments need to do that, and they need to do that for the health of the nations. I think I would also like to mention the Intergovernmental Network on Atmospheric Pollution of the Latin American and Caribbean region. Both of these have been established by the Forum of Ministers of Environment for the Latin American and Caribbean region. Of course, the Breathe Life campaign, which is jointly promoted by WHO and the UNEP, which I think is important. Trinidad and Tobago is now a part of that, and you need to do policies in moving in that direction. There's also the Partnership for Clean Fuels and Vehicles in terms of making the fuels that we use cleaner and the vehicles much more efficient. And I think that is a key component that we are doing in quite a lot of countries. And then what we call the MOVE initiative for electric mobility in the Latin American and Caribbean region. We are promoting a lot the conversion to electric mobility, and quite a number of cities have moved towards changing their bus fleets to electric bus fleets. And I think that significantly reduces the air pollution at the city level. So I just wanted to share these ideas with you. I think there's a need to rethink our national policies. And I think there's a need to look at these energy sources that are available and make the investments principally for the health of our nation, but also because it makes economic sense. And another benefit is it creates a tremendous amount of jobs. So the promotion in terms of the economic development of the country is highly mobilized or highly pushed by efforts in this area. So I wish you all wonderful discussions, but I'm hoping that these discussions lead to some policies which can actually make a difference in the lives of the citizens of the Caribbean region. And since this is hosted in Trinidad and Tobago, I thank you very much. And thank you, PAHO, for organizing this, this wonderful opportunity for the celebration of the International Day of Clean Air for Blue Skies. Thank you, and over.
Thank you very much, Dr. Heilman, for sharing those messages and highlighting those key concerns for the region. At this point, finally, I would like to invite Mr. Hayden Romano. He's the Managing Director of the Environmental Management Authority of Trinidad and Tobago, to make some opening remarks. Mr. Romano, have you unmuted?
Okay, are you hearing me now?
Yes, we're hearing you now.
Okay, good. Sorry about that. Mr. Leo Heilemann, Director, UNEP, Latin America and the Caribbean region. Dr. Wheeler, PAHO representative. Our country representative, distinguished panelists, ladies and gentlemen. In my capacity as the Managing Director of the Environmental Management Authority and the Global Environmental Facility Operational Focal Point for Trinidad and Tobago, I would like to convey how proud we in Trinidad and Tobago are to participate in this first UN International Day of Clean Air for Blue Skies. Our country is motivated and committed to unconditionally reducing our emissions and fostering the protection of human health and the environment. Air pollution is one of the biggest environmental threats to health today. Hence, collaborative efforts, as we are doing today with PAHO, UNEP, and all of you, and other similar initiatives are essential to improving air quality. This webinar today will provide a forum for all of us to learn from each other's successes and challenges. COVID-19 has introduced some unexpected challenges, but has also provided an opportunity for us to become more innovative in our approach towards a healthy recovery. Within our context in Trinidad and Tobago, to improve air quality, we are moving upon several initiatives, including our new 2018 National Environmental Policy, which provides the overarching framework for addressing air pollution, legislation such as our 2014 air pollution rules. We now have an extensive and expanding air quality monitoring network, which you will hear all about from the EMA in a presentation which will follow. And of course, communication on air quality information to the public through our Air Quality Index, something which we at the EMA are quite proud of. We have now established 3 stations, one in Port of Spain, one in Point Lisas, and one in Tobago. And you can, and the Air Quality Index is available on our website. And of course, we also have other projects and targeted strategies aimed at reducing warming, improving air quality, and protecting human health. As part of the observance of this first UN International Day of Clean Air for Blue Skies, and in recognition of the theme, #CleanAirForAll, companies and individuals are being encouraged to pledge and take actions that contribute to the reduction of air pollution. Every action counts, so we urge all to act now to clear the air. Permit me to congratulate and extend appreciation to UNEP, PAHO, WHO, for inviting the Environmental Management Authority to participate in today's engagement, as it is a significant opportunity for the EMA in celebrating our 25th anniversary, which we are observing this year. And I look forward to meaningful engagement today on the occasion of the inaugural International Day of Clean Air for Blue Skies. I thank you.
Thank you very much, Mr. Romano, for those very inspiring words. Thank you all to our specially invited guests for those opening remarks. At this point, we will move on to the next segment of our webinar. And so for that, I will hand over to Dr. Taraline Malcolm to moderate the next segment of our proceedings.
Thank you, Ms. Joseph. And good morning again, ladies and gentlemen. My name is Taraline Malcolm. I am the NCD and Mental Health Advisor with PAHO, and I'm based in the country office in Trinidad and Tobago. First, I would like to thank the first three speakers, Dr. Wheeler, Dr. Hyman, and Dr. Romano, for those great opening remarks and for providing a good segue into the rest of the session. But before I introduce the presenter, a few points to note. One, your mics are muted, and if you have any questions as the presentation progresses, please put them in the chat and we will address them in the Q&A section at the end of the two presentations. In relation to the flow, we will take the two presentations and then we'll have one section for all questions and answers and comments. During the Q&A, we will take the questions and comments from the chat, but if you wish to speak, just raise your hand and we will unmute you. And finally, the webinar is being recorded and will be uploaded to the PAHO website. So our first presenter is Dr. Solvi Gumi. Dr. Gumi is from the Department of Environment, Climate Change and Health. Her presentation is entitled What We Know About Air Pollution, COVID-19 and NCD. So the floor is yours, Dr. Gumi. I will unmute you.
Do you hear me? Do you hear me?
Yes, I'm hearing you now, and I'll
Okay,
share your presentation.
Thank you very much, Tara. Thank you for the organization of this webinar. As mentioned, my name is Sophie Gumi, and I'm working in WHO headquarters in Geneva on ambient air quality and health, and very closely with the colleagues from the regions. So, will you start the presentation? Okay, I will. The presentation builds very much on the introduction made by Dr. Wheeler. And I will provide you with a global perspective on air pollution and health. So next slide. So first slides. In the sake of time, I will try to stick to the 20 minutes. Okay, so I have split the presentation into 4 parts. The first one is a few basics and reminder about air pollution and health. The second one, I will briefly discuss the air pollution and NCDs and how they are interlinked and agenda. And in the third part, I will mention the COVID-19 in relation with air pollution, and finally, just a few conclusions. Tara, I still don't see the slides coming. Is it normal?
Yeah, it's projecting.
It's coming.
Okay. I'll stop and share again.
If you want, I can just...
Are you seeing it?
No, I don't see it. Ah, something's coming. Yes. Can you go to the next slide? Okay, wonderful. So as I mentioned before, this is the overview, and gonna be split in 4 parts. So next slide, please. It's not coming. Need some coffee, probably.
I'm not sure what's going on.
It's Monday. Great. Okay. Fantastic. So, as mentioned by Dr. Wheeler, air pollution is a health issue. This is air pollution is responsible for 7 million deaths per year, both from ambient and household air pollution exposure. This is one of the main environmental risk factors. Altogether, environmental risk factors are accountable for 23% of all deaths. So air pollution with 7 million is a large chunk of those deaths. Next slide, please. I will start again with the basics, so you can go next slide. Okay, I will just provide a little bit of history just so that it provides you with an overview of everything we know about air pollution and health. And it's actually quite old because the first reports from WHO on air pollution and health was in 1958. It was an expert meeting where they started listening the damaging effect of air pollution. Next slide, please. Yes, so as you can see in the slides, a lot has come through since 1958. So, first of all, there has been a great number of WHO air quality guidelines. Those guidelines are not only for ambient air quality, but also for indoor air quality. And all over since 1987, there are some guideline level for specific pollutants. The current guideline, or the current air quality guideline is no, not yet. Sorry. The current guideline is being updated, and we hope to have a final version next year. In 2015, for the first time, ministries of health recognized air pollution as a big health issue and gave WHO the mandate to work formally on it. In 2018, there was a big global conference on air pollution and health with 900 participants from all over the world and all different stakeholders: Ministry of Health, Ministry of Energy, Ministry of Environment, cities, mayors, etc. And we all recognize the need to work together and to move this agenda further. And today is in 2020, we have the first UN Day. So as you can see, the issue is not new, and here we are to move things fast. Next slide, please. So this slide is just to show you that there is the geographical distribution of research on outdoor air pollution and respiratory health. So although this is not heterogeneously split, we have evidence from all regions almost, and this is important to recognize, because even though we do not have evidence for every country and every city, which is often an excuse used to not move, we have enough evidence to make to have a very good overview of the impact. Next slide, please. This slide shows that since the 60s, there has been a huge increase of publication on air pollution and health. So this topic has really increased in interest, and there is more and more research nowadays, and especially from countries because originally the publication came from Europe and high income North America, from Canada, from the USA. But nowadays we get there is more and more evidence from China as well, and from other places in the world where air pollution levels are much higher than in Europe or North America. Next slide. So second message that is very important, or first, it depends on how you take it. First, how air pollution, especially particulate matter, affects every organ. So when we speak about air pollution, we always think about respiratory health. We know about cardiovascular systems, but actually there is more and more evidence that air pollution affects many other organs in the body. So we know about diabetes, we know about neurodegenerative diseases and premature birth, etc., etc. So evidence is growing, and this is something that WHO is regularly checking and taking into account and synthesizing as soon as the evidence is coming out. Next slide, please. Third message, there is enough data on exposure and health impact, and this is seen because three sustainable development indicators have been linked to air pollution, and WHO is the custodial agency for those indicators. The first one is air quality in cities. We know that 91% of the world is exposed to an unhealthy level of air. The second one is clean energy access. Clean energy access, this is linked to household energy for cooking, eating, and lighting. And today, as we speak, there are 3 billion people relying on polluting fuels for cooking. This is unacceptable. Even though the percentage of people having access to clean fuel is increasing because of population growth, there is still 3 billion since almost 30 years. So the progress has been far too slow. And finally, the third one is the mortality indicator. It's the result. So the result is 7 million deaths, as we saw before. Next slide, please. So the next slide actually shows that speaks about SDG 11, so air quality in cities, which is related to the monitoring of air quality. WHO is hosting a database on air quality on particulate matter, annual mean on part of particulate matter, since 2011, so it's now 9 years. And there has been a 4 version of this database, of this collection of data. And the screen has disappeared, but just to say that the message is that awareness on air pollution has been increasing, because there is every time we release an update of this database, there is more data. So there has been a huge increase in data availability and monitoring and awareness of countries of actions being taken to monitor a bit more air pollution. And just to give you an example, in 2011, there were 1,100 cities that had publicly available data. And in 2018, which was the last update of the database, there were 4,300. So it was like almost 4 times more. This is incredible. And now this database is currently being updated, and we hope to have results by early next year. Tara, I still don't see the presentation. But I can continue speaking if it's better.
Please, Sophie, go ahead. Continue to speak.
Okay, good. Let me just find the presentation on my own computer so that it's easier for me too. So the message is, yes, so the data is available. There is more and more monitoring data. However, something that is important to mention is that even though monitoring is a great first step, something that is very important is actually source apportionment studies. So my next slide that you may see soon is about okay, so this was okay, sorry, so then I come back. Okay, so this is the slide where I was saying that there is an increase in publicly available information, and this is a very good sign that countries are recognizing that this is an issue, and they start monitoring. If you go to the next slide. Okay, this was okay. So beyond particulate matter monitoring, source apportionment is crucial. And we need to know where the air pollution comes from in order to target the key sector. So I think this is something very important. And this is very, 15 years ago, no, not 15, sorry, 5 years ago, WHO released a database on source apportionment studies that were used for health impact assessment. And it was showing that overall, it can be very different depending on the region where you are. And actually, there is even it's even more important to actually know where the pollution comes from at a very local level, because not only your air pollution can come from the local boundary, from the city boundaries, but you also have a large share of air pollution that comes from the regions, but also from international movement. And this is something that is extremely important, because the responsibility for managing air pollution may not lie within the city boundaries, because they might be unable to actually tackle the real sources. So next slide. Unfortunately, as you can, but the problem with source apportionment is that there is very little data still, and it's very expensive to put in place. Okay, next slide was the next message, is that the WHO air quality guideline do provide air pollution guideline level limit, if you wish, exposure limit, and these are taking into account when countries set up their own air quality standards. So as you can see in this map, this is the number of countries that have set PM 2.5 annual standards. So there are still some regions where there is a lack of air quality standard in place. Next slide. However, in the current times, with the synergies between the air pollution and climate change agenda. Last year in September, the United Nations General Secretary at the General Assembly, there was a special day on the climate change climate summit, and over 40 countries and 70 cities answered WHO's call to provide citizens with clean air, and were committing to achieve the WHO guideline value by 2030. So again, here we see that there is political momentum, and that more and more countries do acknowledge the need to provide clean air. Next slide. This is another point, is that tool exists to engage with other sectors. As it was mentioned before in the introduction, it's extremely important to work together, because we have to work together so that we can achieve something. And as a health sectors, we are really committing to trying to develop tools to support. Speaking on behalf of WHO, we want to really empower the health sector to work with other sectors to assess the health impact of policies. And there are many different tools that are developed. So the first one is the one on the Clean Household Energy Solution Toolkit, the CHEST, that I know that in your regions, my colleagues in the regions, in the countries, they are very much engaged in this topic. But we also have other tools in transportation, in walking, cycling, in green spaces, etc. Next slide. Air pollution and NCDs. Okay, next slide. From the mortality from air pollution, from these global figures that are SDG, those 7 million deaths, 90% almost are from non-communicable diseases, and they encompass chronic COPD, ischemic heart diseases, lung cancer, and stroke. So, next slide. The good news is that NCD has finally been recognized as a big risk factor for non-communicable diseases, and now there is a global recognition that this is a risk factor that the health sector needs to tackle. As you can see, in the past with NCDs, there were other diseases, other risk factors like diet, tobacco, and alcohol, and physical inactivity, and they had developed a lot of best buys, what we call intervention or best buys, to tackle those risk factors. And now we have air pollution in addition. And this is where now WHO is focusing a lot of effort to really trying to develop those best buys. So if you go to the next slide. So the idea is to really provide the health sector with a list of interventions that can be used to really reduce those the burden of disease from non-communicable diseases. And On the household air pollution domain, we have much more evidence and interventions, because on the WHO is working very closely with the energy sector now to try to really develop interventions with the cooking fuels and technologies, and with a lot of recommendation from the WHO guideline for indoor air quality. And this is a great movement. On ambient air quality, we are not that far now. We are really at the process of developing those best buys. And this is not an easy solution, because we really have to move from individual interventions to wider environmental interventions. And it is much more difficult, because there is much less studies and tools to actually assess effectiveness of interventions, because we cannot only look at health, you have to look at other issues. And this is a more difficult to do, but we are working on that. Next slide. So this is just to show that NCD is really tackled. NCD as an air pollution is also tackled within the UN family at a global in the wider UN family, with this UN interagency task force on NCDs. And there is a specific group that looks at environment and climate change. At environment and air pollution is the main focus of this task. And the idea is also to develop investment case in some countries, to see how much an intervention will cost and how much benefits you will return on it. Next slide. Now, air pollution and COVID. Okay, next slide. Okay, air pollution and COVID, this is a very hot topic. So we'll have just 2 slides on this. The first one is, what do we know? So the potential links between exposure to poor air quality and vulnerability to the impact of COVID-19 are being investigated by the health and scientific community. This is ongoing work. We have read a lot in the media. There is a lot of publication every week that are not peer review. I mean, they all framework is changing, like there is almost instant information on what happened and so on. But this is we have to be very careful and very critical in reading and not jumping to conclusion. So what do we know for sure is that air pollution is known to have detrimental effect on the respiratory and cardiovascular systems, as well as impact other diseases that I have shown in the previous slides. And those diseases, they have shown to raise the risk of COVID-19 severity. So this is something we can say. We don't know exactly how much, but we know that air pollution has an impact, and that on those diseases, and those diseases are also been shown to be increasing as COVID-19 death. As a result, it is crucial to consider improved air quality as an additional measure, not only to help reduce the burden placed on people's health, but also on the healthcare systems, because people go to the hospital because of air pollution. And if you want to really reduce the pressure on those on hospitals and healthcare places, we also have to really continue to work towards a reduction in air pollution. Next slide. What can we do now? From a health sector's perspective, we can define near-term and longer-term research priorities for strengthening the knowledge on the links between air pollution and COVID, including the impact on the lockdown and reopening measures. We have heard in the introduction, and this is true, that with the lockdown, in some places, for some pollutants, air pollution have been reduced, however, not for all. But there is also the danger that there is a shift of switching from one source of pollution to another one. So jumping to a conclusion that this was good, or that this is what is good and what is not, this is too early to do so. So this is why we really need to be careful now. We need to measure, and we need to put in place surveillance mechanism to analyze this. Reopening measures also need to be taken into account, and also from a health and social perspective, we have to be very careful of unintended consequences of this. In any case, it is crucial to strengthen to continue to strengthen measure laws, standards that need to prevent and control air pollution emissions. We hear a lot to reboost the economy, that countries are lifting standards or switching to softer rules, and this is something that we really have to fight against, because this is not the moment. An economy is not necessarily it's not a good excuse. On the opposite, the COVID-19 pandemic is an opportunity for healthy recovery, especially given the synergies with climate change and air pollution agenda. And as Dr. Wheeler was mentioning, WHO has recently published a healthy recovery a manifesto for healthy recovery that I invite you to consult at the below webpage. Next slide. So the conclusion, next slide. The health sector that I'm speaking on behalf is a key player in addressing air pollution because it needs to synthesize evidence, to be involved in the health impact assessment of other tools, and to really engage with other sectors to really put health as a criteria to choose a policy. The health sector is important to advocate for action, as we have seen with the Breathe Life campaign. This was a very successful event that we have done with other agencies to really raise the level of air pollution knowledge. And finally, health also can act as a convening power for Ministry of Health, Energy and Environment. Next slide. We still have a lot of work to do on the health side to actually engage with healthcare workers, because air pollution and health, as I show in my first slides, there is a lot of information since 70 years. However, daily healthcare workers who are on a daily basis engage with patients and they get the request that they do not necessarily have the formation, because air pollution and health is not necessarily teach in a medical school. And we really have a lot of work to do to actually educate our own workforces on air pollution. So the Breathe Life campaign has a specific arm to target the health sector professional. We're also trying to work with a specific pilot project, like the Urban Health Initiative is trying to really engage the health sector to work with other sectors to define and to make an assessment of policies, of existing policies, and trying to see where are the health benefits and develop case scenario to see where they could go to choose other policies that will benefit health a little bit more. And finally, we are also building a capacity building material for the health sector that we hope to have complete by early next year, that we could really teach online, that could really be undertaken from a wide variety of health workers, like public health professionals, but also clinicians and community health workers. Next slide. Other key messages is that, so to conclude, there is plenty of evidence on air pollution and health. There is no excuse to wait for more data or for more science. Beyond monitoring, sources of air pollution need to be identified to target key sectors and develop healthy policies. Of course, this has a cost, and this is something that needs to be taken into account. Finally, also tools to assess the health impact of sectoral policy exist, and they need to be used. And we also need to educate and to really support countries to train the people in the government to use those tools. And finally, the last but not least is that the pandemic is a really opportunity for a healthy recovery. And I encourage you to look at the WHO manifesto. With this, I thank you all. And my next slide is a thank you all, and also to provide you with some links and some video that where you can have a look on air pollution and health directly discussed by the experts. Thank you very much.
Thank you, Sophie, for that very informative presentation. As mentioned before, we will take all questions and comments at the end of the two presentations. So I'll move quickly to our next presenter, Ms. Trina Ramalochan. She is a technical officer within the Air Unit of the Environmental Management Authority in Trinidad and Tobago. Ms. Ramalochan will share with us some information on the air quality monitoring program in Trinidad and Tobago. So I will hand her the rights so she can upload her presentation and get started. Over to you, Trina.
Okay, thank you, Dr. Malcolm. I'm just trying to share my content, but I'm not able to. Right, great. So my presentation today will focus on the ambient air quality monitoring network established in Trinidad and Tobago, its design, uses of the data, and I will conclude with an overview of the opportunities we are pursuing for a healthy recovery, the perceived challenges, and the way forward. Now, why invest the resources to monitor air quality? There is an old management adage that is still accurate today, which says you can't manage what you don't measure. And another version is if you can't measure it, you can't improve it. Hence, effective management of air quality demands an effective, robust monitoring regime. The primary purpose for an air quality monitoring network is to assess the extent of air pollution, distinguish between areas where pollutant levels exceed an ambient air quality standard and areas where they do not. So targeted strategies can be developed to achieve the necessary reduction in pollution. Monitoring also allows you to provide air quality data to the public in a timely manner in the form of an air quality index so they can make informed decisions and take appropriate actions to protect their health and the health of their families. And the current COVID-19 situation has helped us to see the value of air quality in research, example, using it to find correlations.
Sorry, Trina, sorry to disturb you. Is it possible to turn up your volume? It's a bit low. Thank you.
Sorry.
Yes, that's much better.
Okay. Yes, so monitoring the current COVID-19 situation has also helped us to see the value of air quality data in research, example, using it to find correlations between air quality and health impacts. So before I go into the ambient air quality monitoring network for Trinidad and Tobago, let me first give you an overview of the Environmental Management Authority and the legislative and policy framework that governs air pollution management in Trinidad and Tobago. The EMA is a regulatory agency that was established in June 1995 under the Environmental Management Act, Chapter 3505. And the EMA is mandated to write and enforce laws and regulations for environmental management, to educate the public, and to control pollution and prevent pollution. The main legislation that governs environmental management in Trinidad and Tobago is the Environmental Management Act, Chapter 3505. And Section 49 of that Act speaks to asserting the extent of air pollution and to develop and implement a program for the management of air pollution. Its subsidiary legislation, the Air Pollution Rules 2014, aim is to protect human health and the environment from the adverse effects of air pollution. This is achieved by identifying the activities that generate air pollution and setting permissible levels or standards for ambient air, which is found in Schedule 1, and stack emissions, which is found in Schedule 2 of the rules. The National Environmental Policy 2018 provides the overarching framework for addressing air pollution, and it calls for all stakeholders to reduce emissions from their activities, and it commits the government to protecting human health by addressing emissions from all sources. The NEP also calls for the government to take action towards developing a national network of ambient air quality monitoring stations. And as mentioned in the presentation before, the government of the Republic of Trinidad and Tobago is also committed to achieving the United Nations Sustainable Development Goals, such as Goal 3, Health, which speaks to mortality rates attributed to air pollution, and also Goal 11, which requires annual mean levels for fine particulate matter, both PM2.5 and PM10. So the main objective of our National Ambient Air Quality Monitoring Network is to collect data that can be used to make informed decisions to best manage and improve air quality and safeguard human health and the environment. The graphic on the screen provides a simple model of the network. Monitoring stations are established at various locations within Trinidad and Tobago. The stations are connected to a centralized data management system known as the Air Quality Management Information System, which assimilates the data from all the stations and produces the air quality index that is publicly available. The air unit of the EMA processes the data collected to produce reports for use in research. A key component of the network is our quality assurance and quality control procedures, which ensures data quality. Now, in designing the network and looking at our air monitoring stations, the following were considered. The key pollutants monitored at our stations are particulate matter, both PM10 and PM2.5, carbon monoxide, oxides of nitrogen, sulfur dioxide, and ground level ozone. These pollutants, which are known as primary pollutants or criteria pollutants, were chosen because they are thought to be the most common byproducts of transportation and industrial activity that produce local acute effects on human health. Our air pollution rules also set standards for these pollutants. We also monitor, we also have meteorological data at each station because meteorological conditions can affect the concentrations and behavior of air pollutants. When setting up the national network, monitoring methods and equipment was a key factor. The EMA uses approved United States Environmental Protection Agency federal reference methods and federal equivalent methods. These methods are internationally recognized as being acceptable for monitoring air quality towards legislative compliance. They are also known as the gold standard of air pollution monitoring because it ensures that data is collected in the same manner so they are comparable and accurate. Other factors to consider when choosing equipment is that there must be local capacity to operate and maintain. The stations that we have are owned, operated, and maintained by the staff of the air unit of the EMA. And just a side point that we are a 6-member team, an all-female 6-member team. The equipment must also be suited to local conditions. So initially, one of the things that we needed to consider when choosing our equipment is the high humidity in Trinidad and Tobago. So we have small climate control stations that are fully automatic and they transmit the data via the internet. In looking at siting or where we would site these monitoring stations, we looked at sensitive receptors, population density, source category, and land use. These sensitive receptors included hospitals, health centers, and schools, as well as areas declared as environmentally sensitive areas under our rules. Using a GIS platform, the layers were inputted and overlaid, and then the sites were chosen based on those with the highest population density sources of pollution, such as major highways and industrial areas. And we also looked at where sensitive receptors were located. So this slide just gives you a graphic of the factors that were considered on our GIS maps. So if you notice for Trinidad and Tobago, we came up with 7 proposed sites, and for Tobago, 3 proposed sites. This slide gives you an idea of our present and proposed locations. Currently, our stations are located at Port of Spain at WASA's Beetham wastewater facility. It's downwind from the largest landfill in the country and near a major highway which leads into the capital city. The Point Lisa station is located at TOBAGO House, upwind of the main industrial estate. Tobago station is currently located at Signal Hill Secondary School. Initially, we wanted to site the station at Cove Industrial Estate. However, we had some difficulties in finding a site. But interestingly, the current site is giving us excellent data on Saharan dust. So we also have 2 proposed stations, which will be established by the end of this year. One will be at Holy Cross College in Arima, and the second will be at the Southern Academy of Performing Arts in San Fernando. So if we just go back to the other graphic, you will notice that for Trinidad, we have already, by the end of this year, covered 4 of our major sites. And we would look at additional sites once funding is available. Data from the stations are managed by our Air Quality Management Information System. This system is a commercial off-the-shelf cloud-based application, and the AQMIS processes real-time data feeds from the stations. The data is displayed on an interactive map and allows for the export and import of spreadsheets. It also automatically performs multiple QA and QC operations to ensure that only high quality data gets into the system. It's a modular application, so we initially purchased the monitoring module, which included the air quality index and the public site. And we are currently in the process of adding the emissions inventory and the air dispersion modeling modules. And these modules will allow us to get powerful web-based GIS capabilities for visually interacting with the data. So having such a centralized system allows for efficient management of information. A key feature of our data management system is the public air quality index site, which provides real-time air quality data to the public. This site can be accessed directly through the public site, the address is on the screen, or through the EMA's website, www.ema.co.tt. When you go on the home page, just look for the National Air Quality Index icon, which is at the top of the screen, and once clicked, it will take you directly to the AQI site. The site provides hourly air quality information and shows you the level of concern and the appropriate actions that should be taken to protect one's health. A key aspect of the network is our quality assurance and quality control procedures. The quality of our decisions is only as good as the quality of the data. So our quality assurance program preserves the integrity of the data, its representativeness. So it includes our policies and procedures, such as our quality assurance project plan, our standard operating procedures, our equipment manuals. We also have a training plan for the staff of the air unit. We have preventative maintenance procedures and checklists, a trained certified technician who was trained specifically for the maintenance of these stations. And in the absence of local guidelines, we use international codes and practices, such as the United States Environmental Protection Agency Code of Federal Regulations. Part 58 speaks specifically to the siting of ambient air quality monitoring stations, the design of the network, and quality assurance requirements. Our quality control procedures looks at the measurement process. So, for example, calibration. Our instruments are calibrated using traceable standards, which is essential in data quality. And we also perform precision and accuracy checks and performance audits. Data processing and reporting is done by the staff of the air unit. We have formalized procedures and processes for the collection, recording, the formatting of the data. And with the data, we produce quarterly and annual reports for Trinidad and Tobago. We sometimes produce special reports if requested, and we also use the data for research. For example, this year we have a number of projects. For example, we are currently engaging the University of the West Indies to analyze filter tapes from our Point Lisa site for the months of April to July, which includes the historical Saharan dust event that we had in June. And they have found some really interesting data on metals. So a paper would soon be issued on that. We've also entered into a data sharing agreement with Professor Prospero from the University of Miami, and he's using our PM data to look at trends in Saharan dust episodes for the region. And we are also using the data to produce a research paper on the impacts of vehicular emissions. Just to show you some examples of reports that were done. Now, our monitoring data shows that air quality in Trinidad and Tobago generally meets our air pollution rule standards. For example, our average concentrations of particulate matter PM10 ranges between 25 to 30 micrograms per meter cube in comparison with the annual standard, which is 50 micrograms per meter cube. And for PM2.5, it is generally within the range of 10 to 13 micrograms per meter cube compared to the standard, which is 15 micrograms per meter cube. However, what we have observed is that the major influences on our air quality is Saharan dust and vehicular emissions. So the graph on your left just illustrates the Saharan dust event on June 21st, 2020 at our Point Lisa site. On June 21st, the EMA recorded the highest concentration of particulate matter since we started monitoring. And this event was directly related to Saharan dust. So the orange line represents our air pollution rule standards for particulate matter PM10, which is 75 micrograms per meter cube. But if you notice, on that day, we had particulate matter levels reaching as much as 300 micrograms per meter cube. The graph on your right illustrates how vehicular emissions affect our air quality during peak traffic times. The data on the left is for January 2nd, 2020. And if you notice around peak, the peak traffic times between 7 a.m. to 10 a.m., we have particulate matter PM10 emissions being almost twice as much as the local standard, which is 75. We did a little analysis of our how stay-at-home measures impacted on our air quality. Unfortunately, we didn't have much data for the period because our equipment was subject to maintenance and repair during this time. But we were still able to get some conclusions. For example, we looked at the period March 2nd to March 13th, which was before the measures were implemented, and 2 weeks after, which was March 16th to March 27th. What we noticed, the data on the screen is for the Point Lisa site, and we noticed that there were decreases in the average concentrations of PM10, PM2.5, nitrogen dioxide, and carbon monoxide for that period. The largest decrease of 32% was observed for carbon monoxide. This trend was also observed in the air quality index daily readings. So the table on your left, for example, highlights that on March 2nd, that was before stay-at-home measures were implemented, PM2.5 was, the AQI for PM2.5 was 28, and for nitrogen dioxide was 18. But on March 16th, when stay-at-home measures were implemented, the daily air quality index values for PM2.5 and NO2 were 8 and 10 respectively. Now, the lower the air quality index value, the lower the level of air pollution and the lower the health concern. Similar reductions were observed at Port of Spain and Tobago, and we found an interesting correlation because we looked at a study done by a professor in the University of Toronto, and he analyzed the air quality index for 6 COVID-affected cities and that implemented emergency measures in February 2020. And he compared the air quality index for those cities to February 2019. And he found that all 6 showed declines in air pollution levels between 20 to 40%. And we observed a similar trend with our decline in air pollution. Now, how can air quality data provide opportunities for a healthy recovery? The WHO Director General, in his address to the 72nd World Health Assembly, said that the pandemic is a reminder of the intimate and delicate relationship between people and planet. So our economy is a product of a healthy population, which in turn relies on the natural environment, the source of clean air. So research has shown that there is an association between air pollution and COVID-19 infection risk, and many sources of greenhouse gas emissions also emit air pollutants that raise the risk of heart disease, chronic respiratory disease, and other conditions that increase the risk of death from COVID-19. So to ensure a resilient population, clean air is essential. Plans for post-COVID-19 recovery must therefore look at lessening the impact that we have on the environment. And the WHO Manifesto for a Healthy Recovery from COVID-19 prescribes actionable items, and on the screen is just a few of them, such as developing coherent multi-sectoral policies and actions across all sectors, establishing and enforcing air quality standards, and also ensuring cleaner air through the implementation of cleaner fuels and technologies. So for Trinidad and Tobago, we are implementing such strategies. For example, the major emitting sectors for greenhouse gases in Trinidad and Tobago are power generation, transport, and industry. And our carbon reduction strategy is our action plan for the mitigation of greenhouse gases from these sectors. On the panel discussion to follow will be Mr. Kishan Kumarasinghe, and he could speak more on these strategies and policies as he's leading it through his department in the Ministry of Planning. The nationally determined contribution addresses the reduction in overall cumulative emissions from these three emitting sectors by 15% by 2030. And the National Climate Change Policy, which will be revised this year, provides policy guidance for the development of an administrative and legislative framework for the pursuance of a low carbon development path. Trinidad and Tobago joined the Breathe Life campaign in June of this year and has committed to attaining safe air quality by tightening our air pollution rules 2014 to align the standard for PM 2.5 with WHO's guidelines, interim target 3. And under this, the 24-hour concentration standard for PM 2.5 will be reduced from the current 65 micrograms per meter cube to 35 micrograms per meter cube by the end of 2025. In addition to other health benefits, these levels will reduce the mortality risk associated with air pollution. We are also looking at amending the rules to include a reporting schedule for greenhouse gases, and the EMA is the host of the National Knowledge Management System for Greenhouse Gases, which promotes the transparency framework for greenhouse gas reporting. And the air unit will be looking at the quality control and quality assurance aspects of our national inventory for greenhouse gases. The country has also embarked on a number of projects to address emissions from, example, the transport sector by looking at incentives and disincentives, as well as cleaner energy sources. And we have projects that are underway, for example, the development of a solar park at Piarco Airport and individual solar installations in various areas. So the positive impact these projects will have on our country's air quality can be tracked through our monitoring network and also through the National Greenhouse Gas Inventory. Now, the COVID-19 pandemic has slowed economic activity and disrupted many lives. One of the main challenges is the availability of economic resources. So to advance our air quality work, we are looking at international funding opportunities and partnerships, since the data being collected can be used regionally, especially our particulate matter data. We are also looking at projects that can have multiple benefits through various sectors, so our resources can be used more efficiently. For example, addressing particular air pollutants such as black carbon can result in cleaner air, slowing warming, and also have health benefits. Transitioning to the new normal can also be a challenge, and at the start of this pandemic, the EMA was already in a position where we could have transitioned to working from home and utilizing online systems. The use of digital technology at the EMA has accelerated, and we have found new ways to communicate with each other, and work from home arrangements have reduced the time spent commuting, and we have seen a reduction in our carbon footprint, and the overall well-being of staff has improved. So despite the challenges, we have found a way forward, and it requires an integrated approach to address air pollution and health. We cannot only look at public health interventions, but we must also strengthen health and environmental monitoring systems and use air quality data to support collaborative research efforts. So looking at post-COVID-19 policies can achieve multiple goals, which includes health and environmental sustainability. So resources can be used efficiently. And despite the challenges imposed by COVID-19, we can use these challenges as an opportunity for innovation and integration. So with these words, I say thank you And if you require more information, you can visit our website, or you could also contact the air unit directly through the email address on the screen.
Thank you so much, Trina.
Dr. Malcolm.
Thank you so much for that excellent presentation. I am not seeing any questions in the chat, but we are way behind in terms of time. So I think we'll just move straight into the panel discussion. You hear me? Okay. So we'll move directly into our panel discussion, and we encourage you, while the panel discussion is going on, you can put any comments or question in the chat, and we'll take those at the end or during that session. But I really want to thank Sophie and Trina for those excellent presentations. I'll hand over to Giselle, who will now moderate the panel discussion.
Thank you, Dr. Malcolm. So for this segment, we have invited 5 panelists from across the region to discuss and share on their experiences related to the theme for today's webinar. So I'd like to introduce our panelists. We have Mr. Kishan Kumar Singh, Head of the Multilateral and Environmental Agreements Unit of the Ministry of Planning and Development of Trinidad and Tobago. We also have Ms. Marsha Ann Palmer, Occupational Health and Safety Specialist of the Ministry of Health of Jamaica. We have Mr. Gabriel Murray, Head Agricultural, Nature and Environment of Curacao. We also have Dr. Marcelo Cork, Unit Chief of Climate Change and Environmental Determinants of Health of PAHO. And finally, we have Dr. Tamu Davidson, Head of Chronic Disease and Injury Department of CARFA. For the panel segment, we will have each panelist speak on work being done related to the theme in their various regions or roles. And we will also have specific questions posed, closing with some final remarks from each panelist. So firstly, I would like to invite each of the panelists to just give a brief statement, no more than 2 minutes, on what has been done in their respective areas, in their respective countries, related to air pollution, NCDs, and COVID-19, and any challenges experienced or opportunities that have been identified for healthy recovery. I will start with Ms. Marsha Ann Palmer of Jamaica. So you can just give us a brief summary of what has been happening in your country.
Good morning, everyone. First, let me say thank you for this opportunity, for this invitation, and congratulations on the hosting of this seminar. The Ministry of Health here in Jamaica, our focus is primarily on, well, we are the vanguards of public health in country, but we focus primarily on indoor air quality. But of course, our ambient air does affect our outdoor air. We collaborate with our partners, the National Environment and Planning Agency, on regulating our air quality. So there are various regulations that the Ministry of Health has, the Public Health Act, with the nuisance regulation that provides us the opportunity to that we utilize in terms of enforcing that aspect of the regulation. We also have the Clean Air Act that provides the enforcement for the manufacturing industries. We collaborate with the National Environmental Planning Agency. There's a committee that looks at air quality monitoring from a regulatory standpoint, where we look at applications for the industry. We also have recently our Road Traffic Act was amended to ensure that we have vehicles that were more efficient in terms of how they burn their fuels. We also had an improvement or nations that looked at the utilization of better fuel, and even for energy sector, they're now utilizing more LNG as opposed to gasoline and diesel. So there's improvement in that regard. We also have we also collaborate whenever there are emergencies like fire. We do have an annual, if you want to call it an annual event, where our landfill is it's whenever it's on fire, then we'll collaborate with the National Environment Planning Agency in collecting data, looking at those areas, monitoring the areas that are in close proximity and that would be more affected by the effect of the smoke. So there is need for greater collaboration. The Environmental Planning Agency do have a monitoring program in various areas that would be deemed for mostly our town centers, and where we have our landfill, the industries. There's a active monitoring program that is ongoing, and the information is shared with the Ministry of Health. So we also help with the enforcement. Example, for the bauxite industry, if there are nuisances, there are nuisances, and for any pollution incidents, we monitor the water quality from these entities as well. So there's ongoing collaboration in country, both with ourselves and our stakeholders, also with the private sector. There's also the Jamaica Bauxite Institute that is involved in the monitoring of these activities. So we would have had trainings as well that would help our environment agency to understand better. So there was a training in air quality and the whole epidemiology of it. So that was a shared experience where they would share how the data is collected, looking more at the air quality management program. So that was shared with the ministry, and we also shared in terms of the whole epidemiology of or what the effects of poor indoor air quality would be in terms of how it affects the population. We really would want to collaborate a lot more in terms of the being able to collect and sharing data. There is need for programs to be developed. We would want to have those information, that data that will help to guide the policies and regulations that we very much need to have implemented, or even to amend the existing ones. As it relates to COVID-19, I can't speak so much as to what the data, specifically what data stated in terms of what the air quality have been like over that period of time, but in speaking to my partners from the Environment Ministry, they would have indicated that there was an improvement in the air quality. However, with the Saharan dust phenomenon, there were some increases again in the air quality would not have been showing those successes that the restriction on movement would have had. Certainly, we need to collaborate more in terms of the data and how we collect the data to look at the population, the areas that are greatly impacted, and so there is need, a great need in country for that to happen. We would have started the dialogue. There would have been some activities that is geared towards that, but certainly there is need for more being done as it relates to the collection of the data, sharing that data, looking at the affected populations, and then seeing how best we can have these policies and regulations in place that would improve that will guide the improvement of air quality here in Jamaica. Thank you.
Okay, thank you very much. You have something to add? Okay, so thank you. Thank you very much, Ms. Palmer. I'd like to ask Mr. Murray as well to just give a brief background on what has been done and experienced thus far from the perspective of his department and his country.
Yes. Can you hear me? Good morning.
Yes, we hear you.
Okay. Good morning. Thank you for the invitation. And we are much obliged that you have invited us to share our experiences on air quality, because we are developing some good steps on the matter. What I want to tell is for the couple of 67 years, Curacao has a nuisance act dealing with environmental challenges. But most recently in 2020, now 67 years later, it's like this that we have come through with air quality norms, standards for a community nearby the refinery. We have an old refinery over 100 years, and we haven't been dealing with problems causing by the refinery. And finally, with the court rule of last year, we had conduct many exercises to comply with the court rule and to come with new standards. And I can tell you now. See? I'm putting it in. Yes, we have now come through that for September 1, 2020, we have quality standards at the community of Wishi-Marchena. It's a small community leeward of the refinery. We have now an environmental policy plan for air quality, and with standards, which I have to say, based on European standards. We are going now for European standards into a transition period of 5 years, so we can go in the further to meet the WHO standards, the WHO standards. So we are having a transition now for 5 years, and we started with European standards. The reason for that is we are financing, and we are getting finance, and we are advised. We were advised of consultancies in Holland. That's why we have choose for European norms, and as part of the Dutch Kingdom. That's why too. So another important thing is that we lay down a strategic plan going for 15 years for dealing with the air quality. And this strategic plan will address air quality standards for the whole island of Curacao. Other activities that we are doing now is we are implementing an AirMod system to modeling and monitoring the pollution of the refinery and other stakeholders. I have to say that we already have for more than 10 years a monitoring system with 3 stations monitoring the air quality leewards of the refinery. But the more important now is for us to know which company produce which pollutants, and in any case, so that we can address them personally. That's why we are using now an AirMOS system too. What we are now planning and executing in October is to come with guidelines dealing with the quality of fuel pollutants for the mobile sector. The mobile sector is a sector that we don't have many data of it, so we are going to address first of all the fuel, and then come with a system of monitoring to deal with that too. And in an effort to come with a new legislation that will cover many aspects of the environment, we are now with consultations with all stakeholders in the community, such as the youth organization, the industries, the environmental organizations, and the governmental organizations too, to come with a new environmental act, a new law that will be more flexible and more handsome for the people to understand. So we will go to the future, to 2030, to deal better with our environmental problems. We have also addressed many other issues regarding environmental pollution, air pollution. For example, not only do we have the air quality monitoring that I have already said, but as part of the agriculture part of the sector which I live in, we have a pilot project dealing with innovative system for agriculture, so the people in Curaçao can go over with more innovative ways to produce their own foods, like hydroponics and hydroponic system, so they can produce more food at home. Another thing is that we have our sewage company that is dealing with waste, water, and solid waste that has come with a more system that we can go for more recycling, and that we will stop with dumping more or less with the waste in the coming years. You have a recycling street. Yeah, we do have a recycling street too, to manage the separation of the source of solid waste. So we are studying, this is more that we are studying how as a small island to deal with the landfills that we have to come with a system to recycle the old waste through energy producing systems or something else. That is something that we want, because we want to stop the dumping of solid waste. In the transition with wastewater, we also are going to a more system where we can deal more and more with the wastewater of our island that is being dumped in the sea, and now we are collecting them on the best way we can to recycle them to get the water for the agriculture. To protect the nature and the environment, we have established an X team. We call it the X team, to enforce the law at this better way, so that we can have a much cleaner environment. I want to step now to the COVID period to share some experiences. The COVID period, as any country in the world, has hit us very hard. And on the environmental air pollution problem, we have seen that the lockdown has shown something very, very good. The use of cars has been on a low level, so the air pollution was at a very low level. This is something that has stimulated us to come with a program to stimulate our people to no longer use the car, but to use the public transportation more and more. That is a long-term activity and program that we have to execute, because it can be it is a change of attitude, and it will require time to get it into the people. Another part of the lessons learned of the COVID period is we have been focusing on tourism, and our tourist sector is now it's a little bit upcoming, but it was full down, and we now have to better manage, for example, of the sewage and solid waste of cruise ships that are in our harbors. Not that there are tourists on it, but that we can have a better way of dealing with the solid waste that we haven't had much focus on it, of grip on it, to know what was happening to it. Now we know that all that things are going to one company that can manage and that can recycle it. Another thing of the tourism is that with the upcoming tourism from Europe now, we don't receive a lot of tourism in the region now, but from Holland and other parts of Europe. It is like this, that we are controlling the waste much more, because the hotel sector is now cooperating more with the government to see what waste is produces and what is to be done with it, and it is being collected separately, also to be recycled at the company we have over here. A moment, please. Do you have something that I can agree to? No, it's okay. No. This is for now what I have to tell about this, about the activities that Curaçao are doing now on the matter of environment. Thank you.
Okay, thank you very much, Mr. Murray. I would now like to invite Dr. Marcelo Corp to give a few statements on what is being done in his area regarding the air quality and health.
Okay. See.
Thank you and good morning to everyone. It's a pleasure to be in this panel, and a great opportunity, and congratulations to Trinidad and Tobago for the effort that they have been doing in such a day of the International Day of the Clean Air for Blue Skies. At the Pan American Health Organization, the Unit of Climate Change and Environmental Determinants of Health, we're currently working very hard with the countries through our country offices. For example, Tara, that has been done a terrific job in Trinidad and Tobago to not only interact with the health sector, but interact with other sectors as well. However, since we have heard from our colleagues, from Dr. Wheeler, from Sophie from WHO, and also an excellent presentation given on all the efforts that in Trinidad and Tobago they are doing on the air quality monitoring efforts by Trina. Let me give you just a little background of what I think that we have not heard so far, that's one of the things that we are currently focused. And if we take into consideration issues of air quality, clean air, non-communicable diseases, and COVID, there are certain issues that they have a common denominator. The common denominator there is, first of all, the issue of health inequity and the issue of health inequalities and health disparities, that connect clean air with non-communicable diseases and with COVID-19. Currently, with the current situation of the pandemic, that the uncertain times that we are all living, that I hope that you're all doing well, what we are really realizing is that COVID-19 has brought to light several issues in the field of air quality that we were not able to see before because we are currently living a live laboratory. What that live laboratory is telling us? What first of all is telling us is that accomplishing and achieving air quality standards and the WHO air quality objectives is possible. Most cities, most places and most countries, understanding that we are currently in quarantine situation and they're currently living circumstances that are very different than our daily life, but have seen reductions of air pollutions to extents that show us that if we can really work together, we really can go through an effort to really achieve the air quality objectives that they have been guiding WHO for the past 15 to 20 years. And that by 2030, we can do a good job at that, as Dr. Hellman mentioned, with different type of transportation, with different sources of energy, with different ways of dealing with agriculture and burning, etc. The second thing that we have learned in this pandemic is how health disparities and health inequities, they come to life when we live in circumstances that are not our usual lives. And that's really what we are currently seeing. We're currently seeing that those people that they have suffered respiratory illnesses and that they have really have cardiovascular diseases together with issues of air quality, either outdoor or indoor because of the use of contaminated fuels, they can really be under greater stress for probably greater stress for really being contacted and being exposed to COVID-19. That either because of the economic situation they live in, the type of neighborhoods that they live, more people closer together, or because of the exposure to air pollutants. For example, if we live in a closed environment and we are using contaminated fuels, and on top of that, we are being exposed to the virus, it may have greater consequences that to other type of population. Like Sophie mentioned, though, all things are different. All these issues are studies. They're not, nothing is definitive, but definitely they give us the guides and the directions to where to look toward the. What are we doing so in the Pan American Health Organization? First and foremost, we really need to do something that we have not done and we've forgotten for the past 20 to 30 years. We need to strengthen the health sector on issues of air quality. As we can see, air quality monitoring primarily is done by the environmental management units, by the environmental ministries, and that's wonderful. That's what we need to work together. But there are components that the health sector need to take responsibility. The health sector should not forget, and they should work toward, really working toward the essential public health functions and the environmental essential public health functions that we have. What are those essential environmental public health functions that corresponds to air quality? What are those guidelines? What is really how to put together the surveillance, the air quality monitoring given by the, let's say, the environment sector, together with epidemiological data, and that's what we need to work together with the NCDs and the NCD surveillance units to put all those pieces together and get better estimates of the burden of disease that they're being attributable to air pollution. We need to work on health promotion. We need to work with our communities. We need to work with other sectors. Those are the kind of things that they are our essential environmental public health functions that we need to work on. We need to strengthen our surveillance. And the other two things that we really need to do is we need to show to the world that the health sector has a responsibility, that we can work towards environmental sustainability, that our healthcare centers and our healthcare facilities can use energy sources that they are clean, and as a primary prevention, we are not using energy sources that they are that contaminate the environment. And last but not least, we have to really go back and work with our communities. We need to work very strong with our communities in health promotion, with other sectors, using a health policies approach at the local level, understanding that there is a context for each community. We should not have a one-fits-all type of intervention. We need to work with each community, with each country, with each subregion, and with the region as a whole in the context that we're living. working in processes together, create the awareness through Breath Life campaign, through these days, through other vehicles that will help us understand that air quality, NCDs, and COVID-19 in this case has shown us that we need to work together. Particularly for COVID-19, some of the interventions that we have focused on is to give technical notes to our country offices so they can share with the countries on issues of better ventilation in indoor environments, how to also relate the issue that the virus may be airborne as well, and how can that relate with the air quality. And it definitely becomes an air quality issue because it's an airborne virus as well. How the using a face cover is no different than when we're looking at emissions, that they are chemical, but in this case it's biological, and the importance of using face covers and the type of face covers that they really will filter and will really help us. We can help the population and the rest can help us. This is a collective effort, and part of our duties coming from environmental public health is just to understand that this is collective, that in this one we're all together, and that therefore the issue of using a face cover is exactly the same as having really controls of emissions controls in a motor vehicle on really in an industry. We really are trying to help the community, and we expect and we want that the community will help us. And that's the main reason and the main statement why the issue of face cover, that we in the air quality field, probably better than anybody else, we have that picture clear, what it really means to control emissions. In this case, the emitters are the humans themselves. And last but not least is really to work together with the climate change community and really help to understand under one umbrella, understanding that COVID-19 is a zoonotic disease, and at the same time that zoonotic disease has really an environmental factor components, that disease has an infectious disease component, and in this one we are all together, from the infectious disease effort, from the environmental public health effort, from the zoonotic disease effort, as a one health umbrella overall. I would like to leave it at this point on that statement of One Health, and I'm open then to a discussion and conversation we may have. Thank you very much.
Thank you very much, Dr. Cork. I'd now like to invite Dr. Tamu Davidson of CARFA to just give us some feedback on what CARFA has been doing, particularly during these times of COVID-19 and the relation to health and disease in her department. Dr. Davidson.
My apologies. Thank you very much. Can you hear me okay? Great. Can you hear me now?
Yes. Yes,
great.
We do.
All right. Thank you so much for inviting CARFA to be a part of this panel. It's certainly timely with what has been happening with respect to COVID-19, with respect to air pollution now being the fifth risk factor for non-communicable diseases. CARFA has been working in several areas, in particular in the area of environmental health, to promote safe environment, has been working with member states for quite a number of years around really improving indoor air quality in the workplace setting and other settings. And they also support member states in implementing what we call environmental impact assessments. As a part of also that support, CARFA has what we call climate change bulletin that's published in collaboration with PAHO, called the Caribbean Health Climatic Bulletin, where it's also a venue of providing that technical guidance to our member states. But in addition to that, throughout the COVID-19 response, we have been developing technical guidance on several different areas, especially to really target our vulnerable groups around persons with non-communicable diseases, older adults, also addressing other special settings, such as sex workers and other areas. So we've done quite a bit of work really trying to stymie and address the area with respect to addressing COVID-19. However, for the non-communicable disease portfolio, one area which we have been focusing on is really addressing NCDs through the life course. And in particular, the food environment, we are implementing the 6-point policy package in collaboration with many of our stakeholders throughout the member states and at the regional level. We continue to look at strengthening our surveillance system. And this is to really have information to really guide some of our interventions at the regional level and to support member states to do that. So a lot of our surveillance strategies are around developing this integrated approach to surveillance, looking at both NCDs, communicable diseases such as COVID-19, and looking at some of the risk factors and environmental hazards. With respect to air pollution and addressing that in the context of NCDs, this is really a new area that we'll be looking to embark on as a part of the 5th risk factor. However, we do continue to monitor what is happening in terms of air quality and some of the climatic changes in order to guide member states to address these NCDs. In terms of how we can better work in this area, I think there's a lot of room for collaboration. We have a good track record within the region in working in the area of water and sanitation. And certainly, I don't see the collaboration on air pollution and really addressing NCDs any different. And we can learn from some of those best practices to strengthen this approach. And I think outside of the environmental health group or ministries or agencies that work in that area, we could also engage, and we should engage, civil society to support this particular effort. So outside of just the health and environment, we need to have civil society involvement to support some of these responses. We also can engage groups like professional associations to really help to move this agenda forward. And so one area, one of our key main strategies that we will be doing over the next couple of months, right back to December, is we will be having a series of webinars also to disseminate some of the technical guidance that we have in CARFA prepared to really address some of these major public health priorities. One area which is also crucial for the region to address is to really strengthen the evidence around the really attributable risk of NCDs with respect to air pollution and NCDs. And really at the country level to look at how we can really, as mentioned earlier on, is to make the case, to make the argument and strengthen the argument around NCDs. So there's need for more data showing the link at country level and within the region between air pollution and NCDs. We need to gather more data and more data to really show that link between air pollution and COVID-19. And certainly we have recognized and identified that COVID-19 does have some opportunities in terms of improving the footprint with respect to the environment and air pollution, at least from the outdoor air pollution with respect to the environment. But when we look at, but there's also the flip side that most persons are now spending more time indoor, and so maybe more at risk for indoor, the health sequelae due to indoor air pollution. So one of the major areas that we will continue and we continue to work on around is really to provide this technical guidance and support around really addressing the area of air pollution and NCDs. And we hope that we will be able to get this regional movement around really improving the quality of data and evidence to guide some of the policy arguments that we need to pose around NCDs, COVID-19, and the link between air pollution. So most of the data and that we have is on a global level, but we do need to put this at a country level. And then to look at how we can cost out some of these investments. What is it going to cost us to invest in a robust system to be put in place to monitor both at the regional level? And of course, I think finally, we really do need to work on building capacity on both sides, both health and environment, to understand the link and the context between NCDs, COVID-19, and air pollution. Thank you.
Thank you very much, Dr. Davidson. Finally, I would like to introduce Mr. Kishan Kumar Singh, Head of the Multilateral and Environmental Agreements Unit of the Ministry of Planning and Development. Mr. Kumar Singh, if you can give us a brief discussion about what has been done and, opportunities, challenges experienced during this time with respect to air quality, public health, climate change, and the opportunities for healthy recovery during this time. So, Mr. Kumar Singh.
Thank you. And a pleasure to be part of this panel discussion. Thank you for the opportunity. I thank PAHO for the kind invitation. I actually, coincidentally, I had to leave another meeting to join this panel discussion, and that meeting is actually focused on what I'm going to talk about. So the Ministry of Planning and Development is the country's focal point for the climate change agreements, which is the Convention, the Kyoto Protocol, and more recently the Paris Agreement. And as such, we have compliance with the provisions now of the Paris Agreement that we have ratified it. And we are in the process in collaboration with the EMA, as you would be aware, or most would be aware, in developing a robust measurement, measuring, monitoring, reporting, and verification system, where we hope to actually track with some degree of certainty and control greenhouse gas emissions from all emitting sectors, power generation, transportation, industry, land use change, agriculture, and so on. So we've already been and pilot tested an MRV system with the EMA as the hosts and managers of the monitoring, reporting, and verification system and the knowledge management system. And we are actually now, the last meeting I was in, that I had to leave, we are in the process of refining or developing plans for refining that MRV system to become compliant with the Paris Agreement's provision of enhanced transparency framework, which now be subject to scrutiny internationally on how we are going to account for our commitments to reduce greenhouse gases as part of our nationally determined contribution. Most would know that Trinidad and Tobago's commitment is rather ambitious. We hope to reduce cumulative greenhouse gas emissions on a carbon dioxide equivalent basis 15% from those three sectors: power generation, transportation, and industry, relative to a business as usual baseline by 2030. And to do that, we're also developing an NDC tracking system that will monitor our achievement, track to achieving the commitment as required by the enhanced transparency framework under the Paris Agreement. So that means that we are already started to engage with stakeholders, industry in particular, in testing the system for them to submit their data so that we can do cost estimations of greenhouse gas emissions going up into the air from that part of the sectoral emissions. For us in Trinidad, the three sectors are the power generation, transportation, and industrial sectors. And perhaps the most obvious targets to look at in terms of getting a grip on the emissions would be the transportation sector. I think we have more than, because we are entirely road-based transport system, we have more than 750,000 vehicles on the road. I think that was at last count. I remember when I was at the EMA, when we set up the first monitoring station, and I looked at the data, this was way back when, and plotted the graphs. You could actually see it was a textbook graph where volatile carbon, NOx, nitrogen oxides, and ground level ozone had that inverse proportion as the day wore on, and with traffic increasing on the roads. So that ground level ozone generation is a critical issue, and therefore our intentions to reduce emissions in the transportation sector as part of the NDCs will certainly look at reducing the generation of ground level ozone by reducing emissions from transportation through mitigation intervention measures such as traffic management. But where we want to go eventually is to look at sustainable transport. The world now is moving towards electric vehicles, and large consumers such as China, India, some parts of the EU, Norway, as early as 2025 or 2030, that they will no longer be offering new internal combustion engine vehicles for sale. And I think the car manufacturers have already taken up that policy signal and have started to embark on more vigorous manufacturing of electric vehicles. That poses a problem for Trinidad and Tobago because we are already a huge consumer of foreign used vehicles, which contribute to traffic jams, while of course at the same time alleviating the socioeconomic burdens on the average Trinidadian because of a lack of a competent and reliable public transport system. So we run the risk of becoming a repository for these foreign used vehicles, and may very well end up in the future being or having a waste issue on our hands as the world transmits towards or transitions towards electric vehicles. So we are hoping from a policy perspective to begin to embark on that same trajectory where we could look at sustainable transport, where electric vehicles charged with renewable energy to give absolutely emissions-free transport would be something that we will be pursuing going forward. Being an oil and gas economy, therefore industry and power generation plays a critical part in the economic well-being. However, with the advent of the Paris Agreement and the intention for the world to become carbon neutral by 2050 or in the second half of this century, transitions towards cleaner energy would have to be made. In our case, we already produce 99% or more of our power generation from natural gas, which is the cleanest of the fossil fuels. So the next step, obviously, would have to be looking at energy efficiency and renewable energy. And that has already started to take some shape with the drafting of an energy efficient policy, which I think is now before the cabinet. And as well, the awarding of a contract to Shell and BP to construct a utility scale renewable energy plant that will account for about 10% of the power generation mix with renewables going forward. So our work has been policy based, giving policy guidance to how air pollution generally can be addressed, particularly from a climate change perspective, and also from an ozone depleting perspective, because we are also looking at phasing out HFCs in the future as part of the Kigali Agreement. We have been working with the EMA to put some of these policy requirements into law by hopefully looking at the air pollution rules, which will make it mandatory for greenhouse gas reporting, hopefully also ozone depleting substances, so that we can develop a database with some level of certainty and quality of the emissions of greenhouse gases that come from these sectors, all emitting sectors, with a view to also identifying mitigation options to reducing these emissions. I highlighted the transportation sector as one of the critically important sectors that needs attention in respect of air pollution at the ground level and the impacts that this can have on human health, mainly because of exposure and exposure time, because of the immense traffic jams that we have during peak time. So going forward on a post-COVID trajectory, I think it's not a linear trajectory by any means, so that we can say, for example, that once COVID is out of the way, as it will be, hopefully, that things will resume to normal. There are many opportunities here to really take bold and transformative steps to really move away from the fossil fuel polluting type industry and the reliance that we have on it, to more clean production, cleaner consumption as we move towards the circular economy, because therein lies a host of economic, socioeconomic, and growth opportunities in clean production and consumption and production patterns. So I will leave it there and will take any questions that anyone might see fit to ask. Thank you very much.
Thank you very much, Mr. Kumar Singh. This comes to the end of the discussion of the panel, so we want to move quickly into the Q&A segment. And we have a couple of questions already, but if you have any questions that you would like to pose, I would invite you all to please quickly put in your questions so that we can finish in the next 10 to 15 minutes. So I'm handing over to you, Dr. Malcolm, to handle the Q&A part of this segment.
Thank you so much, Giselle. And just to follow up on the comment that was made by Mr. Kumar Singh, one of the questions that was asked is whether or not there is plan to implement a charging infrastructure for electric vehicles, such as the e-bikes, electric buses, and so forth. So in your presentation, you mentioned that manufacturers are moving towards these electric vehicles. So I don't know if you want to comment, is there any plans for Trinidad? And if any other panelists or presenters would want to comment on this question. So over to you, Mr. Kumar.
Thank you for the question. And the short answer is yes. We are in conversation. I think the Ministry of Energy is in conversation with the United Arab Emirates. I know the CNGC company that is charged with pioneering or catalyzing conversions to CNG in their new station, I think in Point Lisas on the highway in Cuba, will also incorporate these solar powered charging stations for electric vehicles. The infrastructure and policy and institutional arrangements, the enabling activity has already started with the Trinidad and Tobago Bureau of Standards, for example, developing standards for charging stations for electric vehicles. Some years ago, the Ministry of Planning, with support from the EU, also donated an electric bus to the University of Trinidad and Tobago as a lab tool, if you want, for them to deconstruct or demystify issues related to power generation from solar and wind to charge the electric bus. And so all of that has added to the knowledge base going forward in order to create the enabling environment and put the infrastructure in place so that when the transition begins, that there's no adverse socioeconomic fallouts from a lack of infrastructure to charge these vehicles, which may follow from an increased demand, for example, depending on some of the policy instruments that may be put in place to encourage use of electric vehicles. I hope that answers the question.
Thank you very much, Mr. Kumar Singh. Any of the representative from the other country, if you can respond to the question. If not, we can move to the other question. Mr. Murray from Curacao, Ms. Palmer from Jamaica. If you'd like to speak, just unmute yourself and go ahead.
Okay, thanks, Dr. Malcolm. So here in Jamaica, we've had, there are plans to improve or to expand that network. We have just a few vehicles with charging, with just a few charging ports. There are plans from information presentation energy sector. So there are plans to expand the capacity for charging, and also there are vehicle companies that are advertising the electric vehicles. So there are plans ahead, and currently plans are being implemented to have this activity being built in a more effective way across the country. Thank you.
Thank you, Ms. Palmer. Mr. Murray, any comments?
Yes, I have two points to share with you. It is like this that I was forgotten to tell that our utility company of Curacao will be implementing a program with wind and solar energy in 2022. That means that they are going for more over the 50% on durable energy, sustainable energy. Another point is that we are having more and more electric cars in Curacao. That's a very positive development also in Curacao. And a final remark, I want to work together because right now we are focusing on working in the kingdom of the Netherlands for a lot of things. But I've heard today that there are so many experience and knowledge that we can share in the Caribbean region, and I wanna share more. And I will start by myself by sharing the data that we have on air pollution in Curacao, because I think PAO don't have our measures and our data on such things. Because the first thing that I will do is in the coming weeks to share our data with PAO.
In the last 10 years.
Over the last 10 years, yes. Okay.
Thank you, Mr. Murray. And you made two great points in your comments. One of the purpose of this webinar today was to create that network to facilitate the collaboration across region. So we're happy to hear that you will be sharing the information from Curacao. And then we can definitely see how we collaborate. And that basically leads us into the next question. The question is, has there been any research about the intensified and frequent Sahara dust across TNT and the Caribbean? And are they related to climate change? So I probably could pose this question, because since it's speaking about the Caribbean, I could pose this question to Kafa and Marcelo. I don't know if you want to speak to that. Tamu, do you want to take that one? Are you aware of any research being done currently?
Yes, so outside of Trinidad, there has been research done in this area in other countries. looking at the effects of Saharan dust. Areas like countries like Grenada looked at it, mainly looking at its impact on health, specifically asthma, and increased admissions to hospital because of asthma and respiratory illnesses. So there has been some research done in this particular area in the region.
Thank you, Dr. Davison. Marcelo?
Thank you, Tara. Yes, definitely what Tamu said is correct. However, I want to be clear that even though there are research and there may be some attributions and associations between the sub-Saharan desert dust that they may really move globally and toward the Caribbean region, probably the level of resource apportionment, the source apportionment that will correspond more to the local type of emissions at the air pollution level, what we air pollution, urban air pollution, local industrial, local energy, probably it is much higher overall. However, when we talk about climate change type of issues, that may be a different story since we're talking more on the global environment. So we have to really put that the scale on the different, we are talking here at the community, urban level, at the global level as well, to understand what the apportionment will be and the importance of each of the sources could be. And also when we talk about dust, depends what the composition of the dust, because many times the dust they may not have as much of the health repercussions as local sources of contaminated fuels, that they create secondary particulate matter, and they may have a much greater health impact than the dust that may come from other regions.
Thank you, Marcelo. The next question is to Kishan, to Mr. Kumar Singh. I was wondering whether the EMA has reconsidered putting a testing station at Flagstaff, Northeast Tobago for Sahara dust. This year, the combination of COVID-19 and Sahara dust was depressing. So any representative from EMA could take that one. Trina, do you want to go, or?
Hi, well, I can take a stab at that question. In terms of the locations, as Trina would have pointed out in her presentation, we did have predetermined sites, and these would have been based on criteria that has been developed by the US EPA and other internationally reputable agencies regarding siting of stations. So those locations that were identified for Tobago are what we will be looking at. However, other factors will come into play when we do site the other stations in Tobago. Of course, this is based on funding available. And of course, we do take into consideration the issue of Sahara dust, but we also have to take into consideration other sources of pollution. One of the other ones that we tend to focus on in terms of ambient air quality is vehicular emissions, as well as industrial. So these things are what we take into consideration in siting of our stations. And yes, we will take certain things, including Sahara dust, into consideration in siting any additional stations that we have planned for Tobago.
Thank you, Giselle. Another question, are there any changes planned to reconcile the AMA's ambient air quality, ambient air limits with WHO guidelines for the protection of public health? There is currently a gap with the levels included in the legislation and the published scientific literature. Which member of the EMA team would like to take that one?
I could also take that one as well. Yes, we do have plans for looking at the standards included in our air pollution rules. It's actually one of the things that we have included as a commitment as part of our joining of the Breathe Life campaign. So those things are in the works and is currently being evaluated for amendment of the legislation, which of course, as we know, has a process that it must go through. But yes, the answer is yes, we are taking that into consideration.
Thanks again, Giselle. I think there was one other comment as it relates to EMA. It would be an idea for the EMA to encourage the government of Trinidad and Tobago to eliminate burning at the Beetham landfill and the Studley Park landfill, which are major sources of pollution. So it's just a comment. I don't know if anyone wants to respond to that.
Just me again. Yes, we are actually considering all of these things. The government does have discussions taking place regarding how to treat with some of these issues at the landfills and opportunities and projects that can help to alleviate the situation. Also, these three major landfills are currently undergoing the process of source emitter registration under our air pollution rules. And that process is ongoing. It requires that they do air quality assessments for their facilities that will help us to determine whether or not they need to be permitted and specific conditions that will need to be implemented to treat with those issues. So yes, these things are being considered and we are doing what we can within our control to manage and treat with the issue.
Thank you again, Giselle. So our last comment, I will open the mic for Sophie from WHO. Go ahead, Sophie.
Yes, hello. No, it's just to complement on the discussion about the desert dust. So I didn't mention it in my presentation, but desert dust is one of the topics that WHO is carefully looking at for many reasons. It has become also high on the global agenda. There is a UN resolution on desert dust and health on sand and dust storm, more specifically, and WHO is the health counterpart of this coalition. And we are very interested into looking at the exposure level of desert dust, and we work very closely with the World Meteorological Organization. I don't know if there is anyone who is in your group, because I know that in the Caribbean you have a lot of desert dust issues and that this is carefully monitored. So whatever activities we will engage on, I would be happy to go with my regional colleague, to get back to you to be involved, because this is a topic that we will increasingly work on. Yeah, over.
Thank you, Sophie. I think in the interest of time, we'll have to close off on our Q&A because it's past 12:30 now. So I just want to thank you, Giselle, and thanks to the panelists for those insightful responses. A lot of information was provided throughout the session today from our two presentations and also our panel discussion. I will hand over to Jordi from UNEP to just give us a brief summary and the key takeaway messages. Over to you, Jordi.
Thank you, Tara. Can you hear me well?
I can hear you and see you well.
Okay, thank you so much. Good morning, everybody. As it was being mentioned, a lot has been shared today, so it's not easy to wrap up. But maybe we can start by some of the initial message from the WHO that it has been said that there is enough evidence on exposure and health impacts of air pollution. So there is no excuse to wait for action. Fortunately, through the panelists, we have also seen that actions are already underway in the Caribbean region. We have listen different kind of actions, like at the policy and regulation level, how countries are developing and enforcing new standards, new strategic plans, new regulations in collaboration with different institutions. We have also listened to the importance and the actions on monitoring, for instance, in Trinidad and Tobago, with the key message that an effective management requires effective monitoring, indeed. But we have also see how actions are also taking place in important key sources like waste management, improving recycling, closing dam sites, also on the transport sector, promoting public transport, cleaner fuels, and promoting sustainable vehicles and electric mobility, also on addressing industry oil and gas emissions reductions. So certainly some of the actions are already underway, but still it has been a call to increase capacity building, awareness raising, and collaboration with different stakeholders, particularly from an integrated and multi-sectoral approach to promote this perspective, this health and environment integrated perspective. A lot has been shared also about the linkages between COVID and disease, climate change, and air quality. So some important message is that evidence that achieving air quality standards is possible, but still some disparities and inequalities persist. However, these post-COVID and the recovery plans has been said also how this offers also an opportunity to take bold and transformative steps for a decarbonized transport, for cleaner and production and consumption patterns. So this may be some of the summary key messages that have been shared with us this morning. Thank you. Over.
Thank you, Jordi. Thank you for those. Thank you for those useful takeaway messages. In closing, I would like to thank the two presenters, Dr. Gomi from WHO, Mrs. Ramla Chan from EMA, for their excellent presentation. And a big thank you to the panelists, Mr. Kishan Kumar Singh, the head of the Multilateral and Environmental Agreement Unit in the Ministry of Planning, Trinidad and Tobago, Ms. Marsha Ann Palmer, Occupational Health and Safety Specialist in the Ministry of Health and Wellness, Jamaica, Mr. Gabriel Murray, Head of Agriculture, Nature and the Environment in Curacao, Dr. Tamu Davison, the Head of Chronic Disease and Injury Department in CAFA, and Mr. Marcelo Court, Unit Chief for Climate Change and Environmental Determinants of Health in PAHO. And to you participants, thank you for joining us and for staying, even though we are behind time, but the information that was shared and the interest that was there, we really had to make sure that we get through these discussion and respond to the question. So we hope that this session was useful and that the information will help you as you move forward. And as I mentioned earlier, this is an opportunity for us to work together as a region, to collaborate, to share information, to do research that will be beneficial to the entire region. As mentioned at the start of the webinar, the session is being recorded and the recording will be available on the PAHO Trinidad and Tobago office website. And you can find additional information regarding NCD, air pollution, COVID-19 on the PAHO, WHO, UNEP, CAFA, and the EMU websites and on our social media pages. Once again, thank you for joining us on this webinar in recognition of the first International Day of Blue Skies, and we look forward to your participation in future webinars. Have a great afternoon and a great rest of the week, and we look forward to being in touch with you. Thank you, and over.
Thank you.
Thank you. Bye.
Thank you very much. Bye.
Thank you very much.
Bye. Thank you very much.
Thank you very much. Bye-bye.
Yeah.